So I am Dr. Ted Barnett, the president of Rochester Lifestyle Medicine Institute, and we're so excited to have all of you here tonight for what promises to be a very exciting grand rounds. Tonight we're talking about liver health and lifestyle medicine. Thanks to a generous donation, all of our CME courses and programs that RLMI runs are free to qualified medical professionals. You can take a look at our website. We have one called Jumpstarting Health, which is, depending on how you take it, is worth between 10 and 24 CMEs. We also offer the LIFT project for credit. And if you're an ACLM member, you may have already participated once in the LIFT project, but you can now participate for credit as well. So our panelist tonight, our guest panelist tonight is Dr. Sean Hashmi, who's a board certified internist and nephrologist and obesity medicine specialist at Kaiser Permanente, Woodland Hills, California, where he's the regional director of clinical nutrition and weight management. Dr. Hashmi has earned several teaching awards and routinely mentors residents. He's an author of several academic presentations focusing on nutrition, obesity, and kidney disease. And he's also the founder of Self Principle, a nonprofit organization providing evidence-based health, nutrition, and wellness research and information to help everyone live their best lives. The organization also supports children's education worldwide with school supplies, scholarships, and more. And as if that isn't enough, Dr. Sean Hashmi is also on the board of directors of the American College of Lifestyle Medicine and also serves as the ACLM treasurer. So important guy to know. And all on top of all that, he's incredibly nice. So then our next regular panelist is Dr. Robert Breakey. He's a board certified in family medicine and lifestyle medicine. He has been a family physician in Ann Arbor, Michigan for 36 years and serves as the medical director for IHA's William J. Folletti Institute of Lifestyle Medicine, as well as the chair of IHA's governing board. He's also on the board of directors for these two national organizations, Plant-Based Nutrition Support Group, that's PBNSG, and also PPOD, Plant-Based Prevention of Disease, which I mentioned earlier. And he has a special interest in employing lifestyle medicine approaches for disease reversal. And then Melissa Sundermann, also on our panel tonight, is board certified in internal medicine and lifestyle medicine. She practices at IHA East Brighton Primary Care and is a member of the Academy for Eating Disorders. Her clinical interests include lifestyle medicine, plant-based nutrition, food as medicine, and sports nutrition. Our guest presenter tonight is Dr. Petrescu. Laura Petrescu, who is in Rochester, New York. She's board certified in internal medicine and lifestyle medicine with over 20 years of clinical experience in both outpatient and inpatient medicine, and now runs a direct primary care practice, which you'll hear a little bit about later. In addition to her private practice, she also serves as a teaching faculty and mentor for medical students and residents. She's an active member on multiple medical committees and quality improvement projects in the Rochester area, and completed formal education and training as a certified physician executive through the American College of Physician Executives. Dr. Susan Friedman, on the board of directors actually of Rochester Lifestyle Medicine Institute, is board certified in geriatrics, internal medicine, and lifestyle medicine. Dr. Friedman is professor of medicine at the University of Rochester School of Medicine and Dentistry and founding director of lifestyle medicine at Highland Hospital's Department of Medicine in Rochester. She's RLMI's director of clinical studies, a member of American College of Lifestyle Medicine's Lifestyle Medicine Economic Research Consortium. And she's also a fellow of the ACLM and the author of more than 40 high impact papers, which have been cited over 2,000 times. And that's me at the bottom. You don't need to hear any more about me. And now it's time to hear from Dr. Petrescu, and her case tonight is on liver health and lifestyle medicine.
Thank you so much, Ted, for the introduction. It is my distinct pleasure to present today's grand rounds titled Liver Health and Lifestyle Medicine. As Todd has mentioned, I have been in clinical practice for over 20 years and lifestyle medicine board certified since 2019. And this year, 2022, I have decided to take a leap of faith and venture into private practice and open a direct primary care practice. So direct primary care is a growing movement around the country. However, it's quite new in New York State. Actually, my practice is the first and only in Rochester region. So a lot of people have never heard about direct primary care and ask me, what is direct primary care? Direct primary care is a membership-based healthcare delivery model. People pay a low monthly membership fee for all services in my practice. I offer comprehensive primary care along with lifestyle medicine. So by moving away from the fee-for-service style direct primary care really allows me to offer personalized care and take more time. I can take 30 minutes, 1 hour, 2 hours, whatever is necessary to take care of the person in front of me. So the case tonight is about Brakey. Brakey is a 57-year-old Caucasian woman whom I met end of February. She presented to me with a chief complaint of inflamed liver and high cholesterol. And she also noted to feel unusually tired in the last year. Brakey describes herself as high energy, always on the go, full of life. And for some reason in the last year, she just didn't feel right. What really triggered her to seek my practice was a discussion she has had with her prior primary care physician around December, really focusing around her cholesterol, high cholesterol, and having a shared decision made meeting about statins. And her doctor really took the time to explain the dangers of high cholesterol and cardiovascular health. And at the end of that discussion, the conclusion was her cholesterol was sky high. Therefore, the benefit of statin outweighs the risk of possible further liver injury. So now Brakey generally trusts her doctor. She has been in his practice for over 15 years. They have a really good rapport. She usually is the type of patient that follows advice. And she was a little unsettled about this decision. Furthermore, she felt rather hopeless. And in her words, I thought I'm doing everything right now. I don't know where to go from here. She was really not agreeing deep down with the decision to go on a statin. A little bit about her case background. She has a history of alcohol use disorder in full remission for the last 3 years. Brakey describes herself as a high-functioning alcoholic. She started having trouble with gaining weight and using excessive alcohol around college. And over the years, she has been on and off in periods of remission with alcohol and relapse. However, she managed to finish college and always maintaining a job and managed to keep her family, her relationship with her husband, and take care of 2 children despite of the alcohol. What really changed the whole picture and opened her eyes was 3 years ago, her brother, Jim, was diagnosed with stage 3 liposarcoma. That really have her pause for a second and think about her health and her future, particularly in the light of her family history, which we'll see in a minute is quite significant. She got genuinely concerned about her risk of her possible inherited genes becoming manifest in her lifetime. So finally, she decides to go back to AA meetings, and with the help of her sponsor and counselor and support from her family, she manages to quit alcohol and remain sober for the last 3 years. And she turned her focus and attention on losing weight. So she goes online and reads as much as possible about diet and what can she do to improve her weight. So she tries a number of things, including Weight Watchers and Beachbody and a strict calorie restriction and intermittent fasting, and she manages to lose weight. She loses a few pounds, and after a while, she falls off the wagon and gains the weight back on. So fast forward 1 year later, around August 2020, she goes back to her primary care physician and gets a full evaluation, a physical exam, blood work. She's told everything is okay. Her thyroid looks good. She just needs to exercise a little more and eat healthy. So that's what she's been doing for the last year, and it didn't work. So she's not really getting any help to make progress. So she goes back online to find more resources, and finally, she thinks she has a breakthrough. She finds this alternative medicine practitioner in our local area. She signs up for an evaluation. She gets what she believes is a thorough evaluation. And she is diagnosed with chronic Lyme's disease and intestinal parasites and high levels of heavy metals. Now, per her report, she never had any formal testing, blood work, stool testing to make this diagnosis, but apparently all these diagnoses were based on her history and her symptoms. However, she finds relief by having an answer. She thinks she's finally, she finally knows why she isn't able to lose the weight because she's having all these problems. And she's recommended a treatment plan, which she greatly embraces. She's also recommended to start on a quote unquote clean paleo diet, which we'll hear about in a minute, to help her lose weight. So she goes on and embraces all these recommendations to improve her health. Now, regarding her other medical conditions, apart from obesity with a BMI of 31 and elevated liver enzymes, dyslipidemia, she's otherwise rather healthy. She has a history of rosacea with on and on flare-ups, seasonal allergies. She also claims a history of chronic inflammation and chronic joint pain. She reportedly had a thorough workup done by primary care physician, and she was never really diagnosed with a autoimmune disease or inflammatory arthritis as such. However, because of her family history, she thinks she's at risk for autoimmune disease, so she makes it her goal to do everything that she can to decrease systemic inflammation in her body. Other medical history, she status post cholecystectomy. Her family history is rather interesting. Her mother has had rheumatoid arthritis, multiple sclerosis, Graves' disease, atrial fibrillation, and alcohol use disorder, and died at age 78. Her father died rather young at age 47 from Hodgkin lymphoma complications. She had a sister who died at age 50 with morbid obesity and Behçet disease and multiple cardiac complications. She has a brother, Jim, diagnosed with stage 3 liposarcoma, doing quite well after treatment now. Another brother diagnosed with myasthenia gravis and doing well on treatment. She has another sister with morbid obesity, hypothyroidism, type 2 diabetes. She has a niece diagnosed with a severe form of multiple sclerosis, and another brother who is otherwise healthy but struggles with alcohol use disorder. So looking at her family history, you can understand how she's concerned about her potential lifetime risk of developing any of these diseases, and she is really trying her very best to prevent that. So she wholeheartedly embraces the recommendations made by the alternative medicine provider. Now, this is the list of medications that she has been taking when she came to my practice, and I did my best to look all this up and find out what are there for. The BioPure chlorella is apparently a toxin binder. She was taking 15 capsules twice a day. Mimosa is an antimicrobial. She was taking 4 capsules every morning. Artemisia antimicrobial, 4 capsules every day. Broccoli sprout extract, 1 capsule a day. Curcumin is anti-inflammatory, 2 capsules a day. Remag apparently is prescribed for thyroid health. Even though she was never told that is there anything wrong with her thyroid, she was taking that 1.5 tablespoons a day. SOS hypochlorous is a swish she was doing twice a day. Metaguard 1 capsule twice a day, Beta Plus 2 tablets a day, and selenomethion 2 tablets a day. The last 3 of them are apparently prescribed for gut health. So I would like to pause here for a second, and if we can ask the audience, looking at this medication list and this number of supplements, do you have any experience with these supplements, and what would you do when you're presented with this medication list? Can we continue any of these, stop some of these, stop them all, or just continue all of them? I'd be interested to learn what other people think.
Dr. Hashmi, do you have any comments while we're waiting for those to come in?
Yeah, this is a really interesting case. What I would like to point out is a couple of things. First is whenever people take supplements, remember the regulations around supplements are very different than the regulations around medications. What we found, so I'm a nephrologist by trade, I'm also a practicing obesity medicine specialist. And unfortunately, in both of those realms, I get a lot of patients coming in who are taking stuff. Now, when it comes to heavy metals, the danger lies actually not in the supplement, but usually in the gel cap itself. So what happens is the gel caps, oftentimes they're imported from other countries. The main culprits have usually come from China, and they contain things like lead, mercury, cadmium, arsenic, etc. And then the thing that people forget is it is almost impossible to leach away heavy metals out of the body once they're in. If truly it was possible, then the number of kidney failures that we see occurring because of heavy metals would all be able to be avoided and prevented.
So you're saying that heavy metal exposure is from the capsules themselves?
Wow.
So oftentimes, yeah, so what we find is when the tests get done, they'll often find is the material. So let's say it's curcumin. They'll say, curcumin was made in a GMP certified laboratory. That means good manufacturing practices. And they didn't find anything else in there. That's great. But then the capsule they used for the curcumin had the lead, mercury, cadmium, arsenic, and that's what contained it. So even if the product has been tested, sometimes the gel caps themselves have not. So it's really important to only take what is absolutely necessary. Now, there's a question somebody said, what about veggie caps? It doesn't matter if they're veggie caps because it's from the conveyor belts. It's how the manufacturing is occurring. So once again, if you're not independently testing, and that's why, for example, the USP certification that you'll find in products like Nature Made or Costco's Kirkland brand, which is very expensive to do, is independently testing the product and is independently testing the capsule as well.
Okay, interesting. Well, thank you for that. Yeah. All right, Bob, have we got the results of the poll? There we go. Okay, so looks like yeah. So what do you think, Dr. Petrescu? It looks like 73% of people said they wouldn't continue any.
Yes, wonderful. Well, very interesting. And some people would recommend to continue some of it, but most people would say just discontinue everything. So very interesting. Thank you, everybody, for answering. So moving on with the case. Let's see, how do I do this? About her physical exam, Becky appears, her blood pressure is good, 123/74, heart rate is at 74 beats per minute. She's breathing comfortably at 12 breaths per minute. Her weight is 175 pounds with a height of 64 inches, which puts her BMI around 30. And she's breathing comfortably at room air. She appears her age, she appears comfortable, well-groomed and articulate. She's interested and engaged in conversation with good eye contact. I did not appreciate any scleroicterus on physical exam. Her cardiopulmonary exam is unremarkable. Her abdomen is soft, not distended, non-tender, no hepatosplenomegaly with normal bowel sounds. Her joint exam, her wrists and MCPs and PIPs and DIPs, her ankles and knees appear with painless full range of motion. And I did not appreciate any synovial swelling on her physical exam. In terms of lifestyle medicine assessment, I usually like to go through the pillars, the 6 pillars of lifestyle medicine. So starting with nutrition, Becky is on what she calls whole foods clean paleo diet, taking in 1,200 calories a day. She uses an app to track her calories. She actually enjoys this activity, which helps her stay accountable to the calorie intake. She typically has 2 meals a day, her breakfast/lunch around 11 and her dinner around 4 p.m. She has no snacks. Her meals are centered around quote unquote clean grass-fed beef and clean eggs. She mostly buys organic foods and local foods, and she enjoys home cooking, which is great. She has very little non-starchy vegetables in her diet, and she's very proud to call her diet wheat-free, dairy-free, and alcohol-free. After struggling with addiction for so many years, she finally feels like she's doing something right for her health by adopting this diet. She doesn't have any allergy or intolerance to dairy or gluten, but she has learned that these products can cause systemic inflammation. So she makes a conscious decision to just avoid wheat and dairy. She drinks plenty of water, 64 ounces a day, and she actually managed to lose about 20 pounds on this diet. However, for the last 6 months, her weight has been plateaued. In terms of physical activity, she really likes her exercise, and actually she uses exercise as her stress management mechanism. She walks around 45-60 minutes every day, most days of the week, either on the treadmill or outside. In terms of sleep, no problems there. She gets 7 to 8 hours of sleep at night. She feels refreshed in the morning, no need to take naps. Stress management, she uses online meditation, and she has a number of online support groups from AA meetings. And in fact, she's so committed to her morning meditation and exercise. She wakes up every morning around 5:30. So she has time for her exercise in the morning and meditation in the morning before she starts work. So that is wonderful. That is great. She uses, again, exercise for stress management. In terms of substance use, we talked a little bit about her alcohol use in the past. She also has a history of remote smoking, 5-pack years, and she quit in 1975, and she uses no other prescription or illicit drugs. Social connections, she has a very strong support system with her husband and her 2 adult sons. She's actually looking forward to one of her sons' wedding this summer. She's very engaged with her friends in Rochester and online support group. So looking through her data and records from prior PCP, her thyroid function tests are rather good. TSH in the middle of the spectrum there, from 1.92 to 3.43, been quite okay with her thyroid. Her liver function tests. I want to bring your attention to this table. As we see in the first column, her baseline liver function tests in March 2021, even though she struggled with alcohol use, her baseline liver function tests are quite normal. However, by the end of March 2022, she returned to her primary care physician because of the fatigue. She just didn't feel right. So at that time, March 26, 2022, her ALT is noted to go a little high at 51. However, otherwise really unremarkable. So that cannot really explain her fatigue. So she's told, nothing is really wrong.
Dr. Petrescu, I don't
Yes.
think we're not seeing March 2022, at least I'm not. Is that?
No, it's March 2021. I'm sorry if
okay.
I said 2022 is March 2021. So
Okay.
This is where everything started with her liver. She actually went back to her alternative medicine practitioner and expressed concern about her ALT going up. And quote unquote, she was saying this is rather normal and expected while someone goes on these supplements, and is actually a good thing because the liver is trying to detoxify. So sure enough, she goes on with the same supplement regimen and keto diet the whole year of 2021. She returns to her primary care physician in December 2021 because of the fatigue. She just didn't feel herself. And now her ALT continues to go up, her AST is starting to go up. So she's getting worried about her liver, what's going on with her liver. But she really gets concerned when it comes to talking about her cholesterol numbers. So we have a baseline lipid panel in December 2020, about a year prior. And we can see she at baseline has a rather good HDL 69 and an LDL less than 100, which by average numbers is considered okay. However, 1 year later in December 2021, her LDL has gone up some 90 points and her non-HDL has gone up some 100 points. So she's really very concerned about her cholesterol. And now she's having a shared decision-making with her primary care physician about statins. And she's concerned about cardiovascular health. At the same time, she doesn't want to really risk her liver getting any worse on statin. So that's how she came to my practice looking for maybe some additional advice. Other labs I found in her records prior testing for hepatitis C, a screening testing based on her age was negative. Her hemoglobin A1C over the years was hovering around 5.1, 5.2. Her, interesting enough, I saw these numbers about her hemoglobin and hematocrit steadily going up for the last 10 years or so. So I'm not quite sure if this has anything to do with her case now. I'm just putting this out there as food for thought and differential diagnosis. Is there anything else going on with her liver, given her family history, hemochromatosis, that is just now revealing with adding the toxic supplements, or this is really unrelated? I saw some liver imaging back in March 2021. She had an ultrasound of the liver, which was compared to a prior CAT scan done in 2012 for unrelated reasons. Her liver structure and size was described as normal. There were some very, very small left and right lobe anechoic cyst and hyperechoic lesion. There were very, very small, otherwise normal liver. The CAT scan prior back in 2012 also described the liver as normal size and structure with very small lesions, too small to characterize, otherwise pretty unremarkable. So I would like to open the case to our panel discussions and things that I struggled with, most importantly, building trust in this particular case. She came to me after working closely with her prior PCP and this alternative medicine physician, practitioner rather, and what do you typically do? How do you engage and gain trust? And timeline of lifestyle medicine interventions. Do you typically recommend small achievable steps versus all or nothing? And I would like to hear about your experience in terms of liver health and how could lifestyle medicine interventions help liver health? And about supplements, how do we help our patients navigate the unknown when most of the products out there advertise, talk to your doctor, but there is really no good data to base our recommendations on?
Dr. Petrescu, that was a great presentation. Thank you so much. What an interesting case. And I think all of our panelists will have something to say about it. Why don't we start with Dr. Sundermann, please?
Thank you, Dr. Petrescu. That was wonderful and such detail. So, what strikes me is that we have so many Beckys out there, right? And when Becky is being seen by a traditional conventional medicine doctor and really, of course, trying to do their best, as all of us clinicians are, and looking at numbers and saying, here are your numbers, take a statin, we'll follow up in 3 months, and go on to the next patient. And so Becky, like so many of our patients, really wants more time, wants more information. And I have a lot of patients that come to me similar who have been wanting to get a trusting practitioner. And a lot of times our functional medicine practitioners, our naturopathic, our nutritionists, anyone out there who hangs a shingle, who has time with our patients. And a lot of times our patients are paying money out of pocket for this, right? And investing that time and feeling, walking away after having an hour with this practitioner of like, wow, they really listened to me and heard my story. And they offer hope, right? Like you said, they offer hope that I think I know what's going on. I'm going to do testing. And many times, I would say almost every time that one of my patients has seen an alternative medicine, complementary medicine, and there's no judgment here at all, but there usually is something that we need to take a supplement for. So, right. So Becky is highly intelligent and very invested and proactive in wanting to search for answers and to better her health. And she's one that she sees her past medical history, which we know as lifestyle medicine practitioners, that a lot of her family medical history is lifestyle related, right? With the autoimmune diseases and alcohol related diseases and heart disease. But when someone has spent an hour with you and gives you hope, of course, you build that relationship. So I think that's where the intersect of we as lifestyle medicine providers really bridge that gap between having the knowledge of our conventional medicine background, but also hitting our 6 pillars, taking into context everything. And I think what you were able to get out of her, and and we'll see where this case goes, is to be able to meet her where she's at and maybe ask her, like, what do you think is going on? And I bet she has, some insight into, I'm taking a lot of pills here, right? So I think this is a great presentation. And what we often see in clinical practice is that, and Becky, who's trying all these diets, right? Because our patients, they're intelligent, and there's a lot of mixed messages out there, and they're grappling onto so many different things. And I think that's where we in lifestyle medicine can help, like I said, bridge that gap. So thank you.
Interesting, Dr. Sundermann. Dr. Brakey, your comments, please.
Yes, I want to also thank you for a great case. This one brings up a lot of issues. And to me, I kind of think back to what is food? What did we evolve on literally over millions of years? There were no supplements. There were no concentrated, isolated nutrients in terms of vitamins or extracts from turmeric or others that came to us. And there are going to be idiosyncratic reactions for some people, in addition to the kind of heavy metals in the capsules that some people have, and the liver being our chemistry plant for the body, having first pass from absorption to the portal circulation, gets the brunt of this. So I think that, again, I was in the stop all the supplements, especially with the liver concern as a piece, and you ask all or nothing, that's one step I would take. With respect to the liver too, another key thing to note, not only were the enzymes going up, indicating liver cell apoptosis, but also her serum protein was dropping. Now, this is really a liver function test too, because the liver makes the serum proteins. And many doctors make the mistake to say, oh, your protein level's dropping, eat more protein. No, the liver is being strained by eating too much protein, and it can't make serum proteins. So it's very different, and except in very rare cases of starvation, you don't get protein, serum proteins drop through amino acid deficiency. People get all they need for meeting their calorie needs, as we know from plant foods, and in her case, an excess of amino acids from also eating the animal foods. But her liver is being strained either by supplements, by excess protein, or importantly here, cholesterol. Her cholesterol numbers went up, partly stress and strain, abnormal foods, could be some of the supplements, could be the grass-fed beef and eggs, which even though they may have less pesticide residues, still have high amounts of cholesterol and saturated fat that increase her serum cholesterol. And we know from looking microscopically at liver cells that that cholesterol concentrates in liver cells as well as arteries. And enough of it can crystallize, cause an inflammatory reaction, and move white blood cells to phagocytize that. They rupture, spilling their contents of lethal weapons to kill invading organisms. And liver cells die and get injured as a result of that as well. So I think several things going on here. And in that, you get a cycle. The worse the liver gets, the more it can't metabolize cholesterol, the cells break open, we end up with a vicious cycle. So another piece of this where to help with her liver health is get her on a more appropriate diet. And again, I'm sure you'll come to that at next phase of your presentation. So those are my initial comments. Thank you.
Hey, Ted, I just wanted to, thanks, Bob. Sorry to jump in, but the other concept that I want to talk about or mention is this health halo effect. And so many times I have patients coming to see me that they're eating healthy because the health halo, right? Clean, organic, grass-fed, free range, and somehow the marketing and advertising industry is brilliant, right? And I don't know if you guys have seen Super Size Me 2, and it's just great because he buys this like organic chicken farm, which is really, and pretends that he's going to open this chicken restaurant, and like the marketing behind all of these health halo words is fascinating. And we know that the choline and carnitine and everything that still exists, even if it's grass-fed. So again, Becky has done all this research and really has fallen for what we've all fallen for, is that if you sugarcoat it with grass-fed or free range, it suddenly becomes healthy. So this concept of health halo.
Organic Twinkies.
Very interesting, Dr. Sundermann. Thank you. Dr. Hashmi, your comments, please.
Yeah, so just adding to what everybody else has spoken to, in my own clinical practice, we see a lot of patients come in. The one aspect that I think is really important to this case to point out is this is a person who has a significant history of addiction. And the reason that matters is when people have a problem with addiction, they are very, very vulnerable to doctor shopping. They're very vulnerable to trying different diets. And when they find that those diets aren't giving them the miraculous results, they immediately jump ship and go on to the next thing. And that's where addressing those concepts is also really important. So part of when we have somebody who's an alcoholic who gives up alcohol and is trying to change their life, we have to replace an unhealthy addiction with a healthy addiction. And this is a really important concept is you can't create voids in their life. So one of the conversation points that's always important is as we talk to our patients is not to sort of criticize or make their previous providers seem like that what they were doing was wrong, but to come from the place of, I understand, you're searching for these ideas, you've been working really hard. My job is how do I see where you're at? How do we work together to now make sure that we come up with a sustainable, safe evidence plan for the rest of your life? So this is going to be a journey. You and I are part of a team. We're going to come together. We're going to talk about this and develop. And those are concepts that we forget. When we look at obesity patients, for example, it turns out that the number one person who does quote unquote fat shaming is the physician. And the number two person who does shaming is their own family members. So part of what makes lifestyle medicine so unique is the word life, right? We're in this business where what we're actually doing is helping people to be able to be themselves, to share what scares them, what their fears are, to build those relationships so they start to build that journey. Even things like sleep. Most doctors don't talk about sleep, but what we know is people who sleep less than 6 hours a night, they eat 300 more calories the next day. That's a fact. There's a randomized study showing that. So all of these little details matter. But to me, what's really concerning about this case is we have a person who's got a very strong addictive personality, as can be seen by the fact that they're willing to take what seems like 20, 30 plus pills a day to be able to meet their needs. And I think that is a really important part of this. And when we meet these patients, and we do all the time, it's really, really important to create a psychologically safe space and to make sure that this is a journey that they understand, and to figure out where are the quick wins that allows them to start to build that speed of trust with us, and to understand that they're not going to have results overnight. Now, most of the time when we take them on all of these supplements, we stop the supplements, we stop causing the hepatitis in the liver enzymes calm down very, very nicely. You're going to see a lot of stuff happens just by doing those basics. But the rest of it is, for us, what we have found is time and time and time again, how long does it take for somebody to lose weight and maintain it for the rest of their life? It turns out it is 1 year minimum. So if you weigh 300 pounds, I get you down to 200 pounds in 6 months, and you go ahead and go back and start eating again, you're going to gain weight. And the reason is it takes 1 year for your brain to catch up with your body. And this is the same thing with the addictive personality is, that addiction is always going to be there. So whatever we do, we also have to make sure that they don't become so overwhelmed and into it that other aspects of their life go away. And this is why we have 6 pillars and not 1 pillar. So it's an excellent case, and I really appreciate everybody's discussion.
So thank you, Dr. Hashmi. We obviously could spend a lot more time discussing this patient. She's really fascinating, and you all have such interesting insights. I'm especially interested in, Dr. Hashmi talking about the addictive personality and how we want to make sure we don't lose her, right? She could just, right? Yeah, fascinating. So Dr. Petrescu, would you like to give us some follow-up? How's she doing?
Yes, no, thank you so much, everyone, for your input here. Very interesting discussion. So my plan when I saw her initially, after engaging her and listening to her and using some motivational interviewing to bring up her why and motivation, we decided together, yes, we are going to stop all the supplements. We just don't have enough information to know which one, if any, are safe at all. So she's agreeable with that step. And then I really took the time to talk to her about the nutrition science and the science behind a low-fat, whole food, plant-based diet. So she's very interested to hear what I have to say. At the same time, she was rather skeptical. Going on a whole food, plant-based diet would be a 180-degree turn from what she was currently doing. So she said she's willing to give it a try. However, she really doesn't know how to cook anything without beef or eggs. So she wanted step-by-step resources. So I shared with her online resources and Forks Over Knives starter kit online, and she was very happy to have simple to follow recipes. She just needed to know what to cook, and she was willing to do this for 2 weeks. We also discussed about maybe increasing her calorie intake from 1,200 calories to 1,400 calories a day. The rationale behind that was because of some interesting data I've read regarding starvation mode. When people go on very restricted calorie diets for a long while, and the body becomes so efficient in extracting energy from food, the body tends to store more for later because it's in starvation mode. So I proposed to her to maybe shift that metabolism from starvation mode by feeding a little more calories. And I really wanted to tap into her joy of exercise and maybe tweak that a little bit. She was really doing mostly cardio for 45 minutes to 60 minutes. So we discussed about splitting the time into 35 minutes of cardio walking and include some resistance training. And the rationale behind that is to, again, shift the metabolism towards using different fuel source, carbohydrates and fat as fuel sources. So she's happy to make that change. She would continue with her daily meditation and good hydration and good sleep. So the plan is to come back in 2 weeks and see how she's doing. So here's her 2-week follow-up. She's happily embracing the whole food plant-based diet. She actually enjoys the food. She finds the recipes quite easy to follow and tasty. She enjoys cooking, so that's a win. She feels more energized. For the first time in a year, she has more energy. She feels more like herself. She noticed her skin is cleared and more radiant. She's noting that she feels a little hungry at times. So we talk a bit about getting some low-calorie snacking for those times. And she's complaining of some constipation on and off. So I suggested maybe adding some dried prunes or fresh prunes with her breakfast oatmeal and doing a combination of raw and also cooked vegetables to help break down the fiber so it's easier to digest and pass. So from this time, the blood work, follow-up blood work, now we are March 10th, 2022. Her liver enzymes, her ALT drops almost in half from 53 to 27. And her AST is dropping from 42 to 27. So she's rather happy to see these numbers. Interestingly enough, as Dr. Brakey noted, her total protein over time was low on beef and egg fed diet. And is starting to pick up now on whole food plant-based diet. So that is very interesting and very nice to see. Her lipid panel, her LDL cholesterol dropped from 190 to 104. So that was beautiful to see. Her non-HDL also dropped from 205 to 120. So needless to say, in 2 weeks of work, her numbers are looking much better. She's happy, and I couldn't be happier to see all this improvement. So now she's committed to whole food plant-based diet and wants to continue that. She finally has hope again. Things are working. They're not perfect, but going into the right direction. With a plan to come back in 6 weeks to repeat labs, to repeat liver enzymes and lipid panel, maybe complete the workup with taking a look at her CBC again, some iron studies just for the sake of completeness. Maybe check a hepatitis panel. We are debating whether or not it's really worth to take a look at those small lesions on her liver by repeating the liver enzyme, the liver imaging. Now it's been more than 6 weeks. Unfortunately, Becky got COVID a few weeks ago, and she had to quarantine and isolate. She did very well with minor symptoms. And this time she is very busy prepping her for her son's wedding. So she wanted to postpone her follow-up, but I look forward to see her again soon.
Wow.
So yeah, thank you everyone for listening and for being here tonight. And I'd open the floor again for closing remarks from our panel.
I just wanted to say thank you. Thank you for being there for her. And when I look at this whole case and evolution coming from even her family medical history, that her father died at a young age, in his 40s, single mom, right? And had her own medical problems, including the struggle with alcohol. So think about that stressful household that she and her siblings were raised in. And if you look at their lineage, right, a lot of her siblings have these chronic diseases that, as we know, can be autoimmune, but lifestyle driven. And then as she was trying to get healthier and trying different diets and her clean paleo, about how her numbers went up, and found a practitioner to give supplements to bring those numbers down. But what you were able to reach to her and empower her about is, genes are not her destiny, right? And that a lot of times, I always use genes are not your destiny, recipes and lifestyles are too. But within her own ability, with your guidance, she was able to circle back to her own health. And I think that's the best gift you can give our patients, is that she did this on her own, of course, with your guidance. And that's what's so special and rewarding about being in lifestyle medicine, is to see our patients truly get better. So thank you. And I'm glad that Becky is doing much better.
Great thoughts. Dr. Hashmi, any other thoughts? In particular, do you think her liver is getting better because she changed her diet, or because she got rid of her supplements, or both? Or don't we know?
I don't think we'll ever know the answer to that question. We would always like to assume that it's going to be the former, because when we look at fatty liver, specifically fatty liver progressing to hepatitis, we know that if we can get these patients on a low-fat diet, they do really, really well. And the more plant predominant they are, the better off they end up being. We have about 10% of the population we end up seeing who's actually normal, healthy BMI, have fatty liver. So correlating BMI with fatty liver, there's a caution to be had. We have a lot of patients walking around right now who are either on the SAD diet, which is the standard American diet, or other variations of it, whether it's keto, whether it's paleo, which is a little more permissive in the sense it allows fruits, but it's still very meat heavy. And all that fat, once it goes inside the cells, it creates all this insulin resistance. So there's a lot to be learned about this case. And even after the patient gets weight that's within the normal BMI range, it is just as important. And for patients that we see who have a normal BMI, it does not exclude the fact that they can't go on to progress to liver cirrhosis.
Right. Interesting.
Interesting.
We do have a question in the chat. For Dr. Hashmi, could you please repeat how you advise patients to select safe supplements if they insist on taking them?
Yeah, so in terms of, when we look at what brands are considered to be the safest, so if they are independently tested, that is the thing that is usually very, very important. And the two companies, which are actually the same company, so I have no sponsorship to Costco, except every time my wife and I go, we spend way too much money there. So everything in our house is Costco bound. So that's my disclosure. But Costco's Kirkland brand is USP certified. What that means is that they actually send it to an independent body for testing. The reason that most supplement companies don't do that, and they only put in things like GMP. What GMP stands for is good manufacturing practices. That is just basically saying that the factory is supposed to align themselves with what the FDA says, but the FDA never comes and checks them unless there's some kind of massive, thing that happens, like there's a lawsuit or something happens. So therefore, the best supplements out there are the ones that are independently tested by somebody who is an entity that does not have a financial arrangement with the supplement manufacturer. And that is Costco, which is Kirkland brand. And so in my practice, when we have patients going towards certain supplements for bariatric surgery, for kidney disease, etc., we always recommend Kirkland because we tend to think of them as being a lot more stringent than some of the other companies out there.
Excellent, thank you. So I just want to let the audience know we're going to run over by a couple of minutes because I do want to hear Dr. Brakey's response to one of the questions here. What would the panel do for the patient to prepare her for her son's wedding, a vulnerable time to maintain for her compliance?
Yeah, I think that's critical in lifestyle medicine. We look at not just the person, but their environment, their social setting, their goals, their views, their visions, and their belief systems. And clearly, this is a motivated patient. She does what she's asked because she wants to be there for the wedding. She wants to live. She wants to be able to exercise and enjoy life. And I just really want to compliment Dr. Petrescu for rescuing her, for finding a person who was, as Melissa mentioned, had genetic tendencies, addiction tendencies, to be headed down a path of despair. And a practitioner who was well-intended, but leading her astray. So you brought her back and helped her to see that what she was experiencing, obesity, hyperlipidemia, and early hepatic liver disease are reversible conditions, mostly based on diet, because she look at her other lifestyle medicine pillars, she was doing right well. And it's a good illustration too. We often say, well, which is the most important? And I say they're all important. And yet without the right diet, if you're feeding the wrong organism, the wrong food, especially organs like the kidneys, heart, brain, and liver are dramatically affected. So great job in helping her to see that the combination of the supplements and her meat sweet diet. Another key component is the high fructose corn syrup. And 1 can of soda a day dramatically increases the risk for non-alcoholic fatty liver disease. Liver metabolizes fructose, artificial fructose, high fructose corn syrup differently than most other sugars, and turns it into fat, which is then stored and inflammatory for the liver. So, so thank you for presenting the case, for helping rescue this kind-hearted soul who now will be able to go not only enjoy the wedding, but many more healthy years to her life, thanks to your intervention.
All right, so I really would like to, yeah, Dr. Petrescu, do you have any anything else you'd like to tell us at this point?
No, thank you everyone for your thoughts and insight. It's wonderful to hear, and thank you, Dr. Hashmi, for talking about the supplements. I typically get quite uncomfortable, and my first tendency is to just stop everything. We would just stop everything, but maybe yes, some people really get not addicted, but they really want their supplements. So how do we guide them? So knowing what's a safer, at least a safer alternative is good. So no, I really appreciate everyone's input and discussion for the case, and be happy to help Becky in her journey.
Yeah.
Hey, Ted, can I ask one more question to the panel?
Sure.
So thank you, Dr. Hashmi, with the USP. That's great information. And we've got a Costco right near our office. So I love that. So for some of my patients using herbs, I will direct them to the NIH branch of National Center for Complementary and Integrative Health, like nccih.com, where you can look up the herbs individually and actually see evidence-based and then interactions. And just wondering if anyone else on the panel has utilized that database or referred patients to that database.
Anybody else on the panel?
I haven't used it a lot. I tend to think of, in general, people should eat real food. And I think, as you say, there's a way to help see. But the other problem is you might look at what its particular metrics are, but how it interacts with so many others, and foods and lifestyle measures is still a big unknown. And then the regulation, you don't even know you're getting what you're getting. So I think you're right. It's a good resource for people who insist on it. Dr. Hashmi, do you have any experience with that?
Yeah, so we use the natural medicines database. It's naturalmedicines.therapeuticresearch.com. And we have that available. Most of the academic organizations, they'll have like up to date, and they'll also have this available. So if you don't have it, you can certainly do it. But what they have is their database, I found, is the most complete. You still have to validate the studies on your own to make sure that they're legit and so forth going on. That's number one. Number two, just a couple of pearls for those of you guys who have patients who are absolutely insisting. So remember, powders over pills, always. And if you're going to go for powders, so for example, curcumin or turmeric, people are really big on turmeric and they want to take it and so forth. It's better to take it as a powder form than it is to take it as a pill form. You're less likely to have stuff. And if you're going to take it as a powder form, that's where taking it as organic definitely matters, because you're going to pay pennies extra for it, but you're going to reduce the amount of heavy metals that are going to be found in it. Doesn't guarantee there's no heavy metals. It just means that there's going to be less heavy metals.
Once again, thank you all very much. And Dr. Hashmi, especially thank you from flying in from Los Angeles like you did. So it's great, just great. And thank you, Dr. Sundermann and Dr. Brakey, for checking in from Ann Arbor or wherever it is you are in Michigan. And Dr. Petrescu, thank you for walking all the way down here from Rochester, New York. So it's great to see everybody. And thank you to our engineer tonight, Bob Franke, and Dr. Susan Friedman, our case wrangler, and any other RLMI staff who are on the call tonight. I know Brian Bell is out there. So thank you all again.